You are about to begin your Dynasplint instructional video, but just a note before we start. Most of the time, Dynasplint systems are a rental product, and you are responsible to return it at the end of your treatment so that you're not charged for the replacement cost of the splint. When your doctor, therapist, and Dynasplint sales consultant agree that your treatment is complete, please view the simple How to Return Your Dynasplint video located at the bottom of this page. The shipping's prepaid and your label's in the box. Now, let's get started.
For patients who have difficulty bending at the waist, there's an alternate method of fitting the knee flexion Dynasplint. Open the back of thigh and counterforce straps. Place the Dynasplint on the front of the leg. With the two round cams slightly above the knee, slide the Dynasplint into place until the cams are at the joint axis. To hold the Dynasplint in place, fasten the counterforce strap. After the counterforce is in place, you may need to push the cams towards the back of the knee again and retighten the counterforce strap. You may need to do this a couple of times. Your sales consultant will have marked a line on the counterforce strap so that you know how tight to make the counterforce strap. Next, attach the back of thigh cuff. Slide it through the D-ring and fasten. You should be able to run your finger between the thigh and back of thigh cuff. Next, recheck the counterforce strap, making sure that it has not slid towards the back of the knee. If it has, push the cams down and retighten the counterforce strap. In order to wear the knee flexion Dynasplint while sitting, you may need to place a pillow or a rolled towel under your thigh. In order to remove your knee flexion Dynasplint, firmly place your foot on the floor and simply open the back of thigh cuff and counterforce strap. The Dynasplint will easily slide from the front of your leg. Please review the tension your Dynasplint sales consultant set for you initially. In the beginning, the splint should be worn for 2 to 4 hours. Do not increase the tension until you can tolerate overnight wear. Time is the most important factor, and your first goal should be 6 to 8 hours of pain-free wear. After achieving this time goal, when you take the splint off, if you have less than 1 hour of stiffness, turn the tension up by 1 on both sides. However, if you are unable to wear the splint for a prolonged period of time, decrease the tension by a half to 1 full turn. During the process of regaining your range of motion, if you have any questions or concerns, contact your Dynasplint representative.